Hello friends, I am Dr. Randeep Vadhavan. I am Head, Department of Minimal Access, Bariatric and GI Surgery at the Manipal Hospitals, Dwarka, New Delhi. Today we'll discuss something about obesity and what are the treatment options available for obesity. Obesity is a worldwide pandemic. There are nearly 2.5 billion people across the world suffering from this. It seems obesity would be limited to a few countries worldwide, but that's not true. It's across the countries, and India is no different. In fact, if we look at the statistics, there are more people dying of obesity and obesity related problems rather than malnutrition in the world. So, what are the obesity related problems that somebody can have? Those are cardiovascular problems, type 2 diabetes, uh, gastroesophageal reflux disease, some cancers which are directly related with obesity, or obesity is a direct implication to these cancers. Then some problems associated with infertility, then psychological disorders, depression, certain other problems which come with obesity. So there are a lot of issues which come with obesity, and therefore it's always best to get it treated and get the right treatment for it, and ensure that you are healthy and you have a long and a healthy lifestyle. Now, how do you measure obesity? What is the one measurement which you do when you say that this person is obese or this person is overweight or this person requires a treatment? So one modality by which you can actually do that is by calculating the body mass index. Now the body mass index is weight in kgs divided by the height in meters square. So by this we calculate body mass index, and generally by about 25 or till about 25 is considered to be a normal BMI. Anything beyond 25, then the person comes in overweight or obesity. So between 25 to 30 is overweight, 30 to 35 is class 1 obesity, 35 to 40 is class 2 obesity, and beyond 40 is morbid obesity. And when you reach a body mass index beyond 50, then we label it as super obesity. Now, why do we define all this, or why do we make the distinction between body mass index? The reason is there are different treatments for different BMIs or body mass index. Till 25, of course, the person is normal, doesn't require to do anything except maintaining what he or she is already doing. Between 25 to 30, that's when some kind of attention would need to be required. It may be in the form of dietary regulation, it may be in the form of changing lifestyles, it might be in the form of inculcating the right kind of lifestyle, in the sense following up with a nutritionist and following up with regular pattern of exercise. So we at Manipal have a dedicated department which takes care of all these problems, right from body mass index beyond 25 till whatever. We've treated up to 100 body mass index as well. So somebody who's between that 25 to 30, wherein dietary and lifestyle modifications are required, we have our nutritionist, which is available all the time, all days in a week, where they can advise you what needs to be done at this body mass index, and at the same time ensure that you follow a healthy lifestyle and you become healthy and get to a BMIs which are normal BMIs. Once you reach a body mass index beyond 30, or let's say between 30 and 35, which is an obesity class 1, that's when the intervention required is a little bit bigger or a little bit more than what you require between 25 to 30. It's like a pill. You take a pill for a certain problem, but once your body mass index increases, the pill needs to be a bit stronger than what you are taking between 25 to 30. That's when what we do is we advise certain medical treatments apart from dietary and lifestyle modifications between that segment of 30 to 35. But then there are those people who are type 2 diabetes, their diabetes are not getting better, your endocrinologist is saying from oral hypoglycemics, let's just move to injections, let's go for insulin because we are not able to control your diabetes. Those are the kind of patients who can actually come back to us, and what we advise in this segment is metabolic surgery. It's not a bariatric, it's not a weight loss surgery, it's a metabolic surgery, ensuring that you actually don't lose too much of weight, but at the same time your diabetes or your cholesterol or your blood pressure gets under control, and you by and large either require minimal medication or no medication. So that's where metabolic surgery comes in. Then when we move higher to BMIs between 30-35 or more than 35, that's when you've got obesity and you've got obesity related problems. That's where bariatric surgery comes in. We do multiple types of bariatric surgery. It's not just one surgery which fixes everyone. Like one shirt not fit everyone. Similarly, not one surgery will fit everyone. And therefore, we advise various types of surgeries, treatment or surgeries based on what the requirement of the person is, the age of the person, the volume eating, the BMI of the person, whether the patient or the person has got associated comorbidities or not. That's when we advise the type of procedures which is correct for the person. All these procedures are either done laparoscopic or they are done robotically. Now, robotically, what happens is it is more precise, the recovery is a lot faster, and the patients can go home much quicker. And that is why we advise that either they can be done laparoscopic, or we have the latest Da Vinci robot, where we advise these patients, particularly the super obese who are more than 60 BMIs, to undergo a robotic bariatric procedures. By and large, most of these patients stay in the hospital for about a period of 3 days, and subsequently they are discharged and they are back to normal. We have an excellent post-op protocols where these patients are required to come back to us. We organize the support groups wherein they come in contact not just with us, with our nutritionist, but also with other patients who've undergone procedures. They can discuss, they can get a lot of comfort by discussing those problems with them and getting back to normalcy. By and large, most of our patients would go back to their normal lifestyle in about 7 days' time. So I wish you all the best, and I also wish you a very healthy lifestyle. Thank you.